Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Have you ever heard of Aspirin Exacerbated Respiratory Disease or AERD? AERD is a condition where people experience asthma symptoms after taking aspirin or other non-steroidal anti-inflammatory drugs or NSAIDs. AERD, also known as Samter's triad, a chronic condition that affects the respiratory system. It is characterized by three key things: asthma, chronic sinus inflammation with nasal polyps, and sensitivity to aspirin and other NSAIDs, like ibuprofen or naproxen. NSAIDs are common pain relievers that many people use for headaches, muscle aches, and other conditions. However, for people with AERD, these medications can trigger a cascade of uncomfortable and even severe respiratory symptoms. This reaction is not an allergy in the traditional sense. It is a complex reaction in the body that we are still learning about. AERD typically develops in adulthood, often in people who already have asthma. It can also affect individuals with chronic sinus problems or nasal polyps. Understanding the difference between a drug allergy and AERD is crucial because, while both can cause adverse reactions, the underlying mechanisms and treatment approaches are distinct. AERD symptoms can vary from person to person, but some common signs include worsening asthma symptoms, like wheezing and shortness of breath, nasal congestion and runny nose, sometimes with a loss of smell, frequent nasal polyps that often require surgery, reactions after taking aspirin, such as coughing, difficulty breathing, or facial flushing. These symptoms typically occur within a few minutes to hours of taking aspirin or other NSAIDs. In some cases, AERD reactions can be severe, leading to life-threatening asthma attacks. It is important to recognize the warning signs and seek immediate medical attention if you experience any sudden worsening of your asthma symptoms after taking NSAIDs. The exact cause of AERD is still not fully understood. However, research suggests that it involves a complex interplay of genetic and environmental factors. One prevailing theory is that people with AERD have an overactive immune response to certain chemicals involved in inflammation. When someone with AERD takes aspirin or other NSAIDs, it disrupts the balance of these chemicals in the body, leading to an exaggerated inflammatory response in the airways. This inflammation causes the lining of the airways to swell and produce excess mucus, leading to the characteristic symptoms of AERD. While genetics play a role, not everyone with a family history of AERD will develop the condition. Environmental factors, such as exposure to certain viruses or irritants, may also contribute to its development. Diagnosing AERD usually involves medical history, looking for the triad of asthma, nasal polyps, and aspirin sensitivity. Aspirin challenge test performed under medical supervision. This test involves giving aspirin to observe your reaction safely. Other tests may include imaging for nasal polyps or measuring inflammation levels. Managing AERD involves multiple strategies: avoiding aspirin and NSAIDs, switch to acetaminophen for pain relief, but consult your doctor first. Use of leukotriene modifiers like Montelukast to reduce inflammation. Nasal sprays and steroids to manage polyps and congestion. Biologic therapies such as dupilumab for severe cases. Aspirin desensitization. Under medical supervision, some patients can gradually build tolerance to aspirin. In severe cases, nasal polyps may need removal. Living with ARD can be challenging, but you can improve your quality of life by working closely with your doctor to create a management plan. Maintain a healthy lifestyle to support your immune system and keep your environment clean and allergen-free to reduce inflammation triggers. Thanks for watching. Please subscribe, like, and share.